The evidence does suggest and support that the Omicron variant, for those reasons, is less dire insofar as severe illness and or death. The cabinet then reconsidered what the existing regulations are and has decided, in essence, to continue for a further 2 weeks all of the regulations that are currently in place, save and except for curfew. So curfew will expire tomorrow. However, the large group gathering size will remain at 20. Household mixing continues to be strongly discouraged. And if you must attend a person's household, we're encouraging persons to use antigen testing. Masks must be worn indoors at all times. Also outside, if you are unable to physically distance. Restaurants, bars, and clubs, the tables must be limited again to 10, spaced at 6 feet apart. So all of the existing regulations that are due to expire tomorrow will continue for a further 2 weeks, except for curfew will expire tomorrow morning at 5 a.m.
The decision to cancel the curfew, what was your thinking behind that?
A lot of that is based on what we're seeing, what the evidence is suggesting thus far, insofar as the Omicron variant. Mm-hmm. We recognize that some businesses will certainly welcome the lifting of the curfew. We've always maintained as a government that we need to strike a proper balance between public health and safety as well as economic stimulation. We also recognize that based on the curfew and what we're hearing from the police and so forth, by and large, persons did adhere to the curfew that we had imposed previously. So people are being compliant with the regulations.
Do you see us going in the same direction, I guess? Is that why you've got a 2-week window versus a longer period of time? Are you anticipating looking at other countries that might be the pattern that Bermuda takes?
What we're doing, Dianne, is we will continue to review this as a cabinet because we're looking at what the evidence suggests and supports. As you rightly said, fortunately, there's some other countries such as South Africa that Omicron hit them first. So we're able to look at what is being done there insofar as the trajectory of the Omicron variant. And we will review it again in 2 weeks. And if it looks like the situation is improving, then we will certainly look to provide further clarity to members of the public and address whether or not we need to continue with the restrictions. What the evidence is also supporting and suggesting is that from the initial cases of Omicron, the peak normally takes place between 4 and 6 weeks. Our first case was imported on December 6th. So we're reaching that point now. So based on, again, what the evidence is suggesting in other jurisdictions, we're almost at that peak. So we thought we would review it in 2 weeks to see whether or not that stands correct. And then we will, if necessary, readjust and reevaluate the restrictions that are currently going to be in place effective tomorrow for further 2 weeks.